Thank you very much.
Representative Fritz, you can speak to your bill and then introduce your guest, please.
Thank you very much. This is a bill that I've had before this committee a few years back, and I do have testifiers, so I'll be brief so that they can give their the information that they bring to this bill. This is the Minnesota Family Investment Family Cap Bill. This was capped in 2003, I believe, and it has been an issue for concern for many of us at this table and all of us throughout the state, because it does take money away from our children and the needs and the daily needs that our children in the state require. So with that, I'm going to turn it over and start with Jessica Webster.
Thank you very much.
Right.
Ms. Webster, if you'd like to state your name and give your testimony.
Thank you, Madam Chair. My name is Jessica Webster. I'm a staff attorney with the Legal Services Advocacy Project, which is part of Legal Aid. And so what we're talking about today is the Minnesota Family Investment Program. It's also known as the state's Welfare to Work program. As many of you know, the cash grant that a family gets under this program is based on family size, with the exception of what we're talking about today, the family cap. In 2003, we passed a law that said if any new baby is born onto this program, we would deny that child assistance. This law was passed, as it was passed in a number of states around the country, to essentially discourage low-income children from being born onto these programs. But what we now have is 10 years of data that show that low-income children did not stop being born or they were not slowed from being born. And so we have denied assistance to thousands of children on this program. And I'm going to be brief, because I think many of you have heard this in policy and have heard me talk about it before. But the last thing I'll say is that this has been repealed in Maryland, New Jersey, and Illinois. It's seen as a failed policy. And one of the reasons it's seen as a failed policy is that people are on this program they have a 60-month time limit. Most people are off of this program in 2 years, which means we're only denying assistance to children from the time they're born to the time they're about 2 years old, or for 2 years of their life. And so this is a critical development stage, and that's why we hope the state wouldn't turn its back on children at this point in their life. Thank you very much.
Thank you. And our next testifier, if you'd read your name into the mic, please.
Yes, thank you, Madam Chair and members of the committee. My name is Andrea Rao, and I represent MCCL, Minnesota Citizens Concerned for Life. And MCCL has long opposed the family cap and sought its repeal since it was first implemented back in 2004. Today, 8 years into the family cap, statistics obtained from the Minnesota Department of Human Services and the Department of Health provide a lot of, we think, very interesting information. More than 19,000 children in more than 16,000 cases have had their grants reduced due to the family cap for at least 1 month. Birth rates in families that are suffering from the family cap have not dropped. And from 2001 to 2010, the overall number of abortions in Minnesota has dropped by 22%, which is excellent news. But the percentage of taxpayer-funded abortions being performed in our state has risen from 21% in 2001, prior to the family cap, to 34% in 2010, which is the most recent year that we have information for. Various academic institutions, including a widely cited study from Rutgers, have concluded that not only do family caps not lower birth rates for poor families, but family caps do increase abortion rates, which is evidenced by our own numbers here in Minnesota. On behalf of our more than 70,000 member families, we encourage the committee and the legislature to repeal the family cap. Thank you.
Thank you very much. And I believe Andrea Fitzsimmons is next. Oh, Alexandra, I'm sorry.
Thank you, Madam Chair. And members of the committee, my name is Alexandra Fitzsimmons, and I'm the Legislative Affairs and Advocacy Director for Children's Defense Fund Minnesota. We advocate for policies that primarily accomplish two goals: one, that improve child well-being, and two, that seek to strengthen the economic security of families. And we do believe that repealing the family cap does both. Generally, as you heard from Ms. Webster, the MFIP grant amount is based on family size. That actually is true no matter what. It's based on family size. But No adjustment is made for the additional cost of a newborn if the family was receiving MFIP assistance at the time of a baby's conception. So this lack of funds further financially strains the approximately 1 out of every 7 families receiving MFIP assistance with a newborn. The current MFIP grant leaves a family of 3 at 62% of the federal poverty level. If an additional child is born, their income is reduced to 51% of poverty as a result of the cap. This is deep poverty and is highly correlated with poor childhood and adulthood outcomes. We have 2 main reasons for opposing the family cap, and I will be brief. First, the family cap pushes families deeper into poverty, and at a time when families are under a great deal of stress, not just the stress associated with poverty and its associated experiences, but also the stresses associated with bringing home a new baby. Earlier, about a couple weeks ago, my former colleague, Marcy Jeffries, and I talked with you about maternal depression and its impact on early childhood. 44% of caregivers in MFIP families had a diagnosed mental health disorder in the last 3 years. The most frequent diagnosis, depression. One longer-term solution for reducing the incidence of depression includes addressing the broader context in which depression occurs. The significant role that the emotional and financial strains of poverty impose should be considered when evaluating the family cap. And the second reason that we oppose the family cap is that the deep poverty that results from failing to recognize the newborn child is especially harmful to the child and his or her siblings when they are young. It is not solely poverty or the degree of poverty that matters for child outcomes, but when during childhood the poverty occurs. Poverty early in a child's life is especially harmful for outcomes related to achievement skills and cognitive development. I want to leave you just with two pieces of information, two pieces of data. Findings from a 2011 Brookings Institution study examining the effects of family income on school readiness suggest that an additional $1,000 of average annual family income throughout early childhood will result in higher reading and math scores for children in low-income families. So relating this to the family cap, we're looking at about $75 per month additionally for a family, which is about $900 throughout the course of a year. And as far as outcomes during adulthood, according to a 2011 research study, for families with early childhood income below $25,000, a $3,000 annual boost of family income is associated with a 17% increase in adult earnings. So thank you for the opportunity to discuss this bill with you, and I really encourage your support in repealing the family cap. Thank you.
Thank you. Linnea House.
Thank you. Chairwoman Norton, members of the committee, my name is Linnea House. I'm the Executive Director of NARAL Pro-Choice Minnesota. We are a 50,000 member strong nonprofit organization committed to protecting women's reproductive rights, including the right to bear and support healthy children here in Minnesota. I'm here to testify in support of House File 256, and I strongly urge your support of this bill. As the law currently stands, the family cap within the Minnesota Family Investment Program actively denies family support to low-income children born to low-income mothers. At all levels of our policy work, NARAL Pro-Choice Minnesota supports programs that allow women to make the reproductive health choices that are best for them and their families. This current law is a means of controlling those reproductive health care decisions, and we believe that low-income women deserve to have the support to deliver and raise children the same as every other Minnesotan. Minnesota public policy should not allow politicians to interfere with a woman's ability to determine the family size based solely upon her income. In addition, it is particularly concerning that current statute also states that there are exceptions for coverage if the child was conceived as a result of sexual assault or incest, provided that the incident has been reported to a law enforcement agency. This exception collides with personal privacy by requiring parents to disclose to the state of Minnesota how a child was conceived and the reproductive choices. We strongly oppose any types of personal privacy exceptions placed into Minnesota law. Finally, a continued investment into family planning programs that allow all Minnesota women the ability and the autonomy to make decisions about when to start or to expand their families is critical. Nearly 250,000 Minnesota women are in need of publicly funded family planning services, and I also urge your continued support of these investments as well. Thank you for your time.
Thank you very much. And I think we had someone from the community that would like to give brief testimony, please. We have one more bill we were going to try to get in today, if we can do it.
Thank you, Madam Chair and members of the committee. My name is Deb Knichny. I'm a member of the Welfare Rights Committee. We are an all-volunteer committee made up of current and former welfare recipients. The Welfare Rights Committee fully supports and encourages you to support a repeal of the family cap. We have worked many times to repeal the family cap in former years, in addition to the numerous other cruel cuts to MFIP families that have taken place. Right now, 70,000 children in Minnesota, 70,000 are living in what is considered extreme poverty. Extreme poverty means hunger for 70,000 children. It means homelessness for these children. And it means not even having a fighting chance at a normal and quality education. These 70,000 children are in extreme poverty not only because of the bill before you, the family cap, but actually primarily because the MFIP grants have not had one dime of increase in the past 27 years. And there is a bill that would lift Minnesota children out of extreme poverty overnight, HF 433, which would give the first grant increase in 27 years. And yet it has not even been allowed a hearing in the House, and we want to know why. This bill is a finance bill, deserves to be heard in this finance committee along with the repeal of the family cap, and we want to know why this bill is being silenced. We know that the budget targets are terrible, but it really has no relevance on the family cap, repealing the family cap, or increasing the MFIP grants, because the money to do both of those things should and can be entirely funded by the federal TANF block grant, which is supposed to be used for MFIP families. However, 73% of these federal funds have been rated to pay for other things, and we want that money paid back and used to repeal this family cap and to give a significant MFIP increase. So I want to appeal to this committee, and maybe even principally to the Democrats in this committee. You now have the absolute ability this year to bring 70,000 children in Minnesota out of extreme poverty and homelessness. And we want you to not neglect this responsibility. We call for you to take care of both of these things because the time is now and it's long overdue. And we appeal to you to do this for our children in our state. It is the right thing to do.
Thank you very much for your testimony. And now it's time for members to be able to